Hey, what's going on, guys? Welcome to another video on my channel, Hairliciously. If you guys are new to the channel, please make sure to subscribe so that you guys are updated on hair loss and hair transplant topics, as well as updates on current hair loss treatments in the pipelines. Visit my website at HAIRLICIOUSLY.com to purchase your microneedling device, which is scientifically proven to stimulate hair growth, my low-level laser therapy cap, DHT blocking shampoo, conditioner, and serum, hair growth vitamins, and a few other products to help those who are losing hair. Now, I hope that everyone had a wonderful Christmas. So in today's video topic, I actually wanted to give you guys an update regarding a company that you guys probably have heard of at some point or another. If you haven't, this company is called Replicel, and to give you guys a quick rundown on what this company has been doing. Basically, Replicel is a Canadian-based regenerative medicine company that's focused on aesthetics and orthopedics. They have a few ongoing studies ranging from autologous cell therapy for the treatment of UV damaged skin, therapy to treat chronically damaged tendons, their Rci-02, which is their dermal injection device. But Replicel is well known in the hair loss community for its Rch-01 treatment, which is aimed toward an autologous cell therapy utilizing dermal sheath cup cells isolated from the hair follicle to treat androgenetic alopecia. These cells are isolated from the follicles in the back of the scalp, which is known to be resistant to DHT. And these cells regulate the growth of hair fibers in the follicle, and they are cultured and multiplied and then re-injected back into the scalp on balding areas for potential regrowth. So a few years back in 2017, phase 1 in clinical trials was a success. 5-year trial data confirmed the complete safety profile of a high dose of dermal sheath cup stem cells for patients with pattern hair loss due to androgenetic alopecia. Histopathical evaluation of injection site biopsies taken 2+ years after injection. It did not reveal any pathology indicative of any tumors or foreign body formation such as cancer. So safety-wise, everything went as planned, no adverse side effects. And then last year, additional research which happened in Japan through their sponsorship with Shiseido for their dose-finding study was a bit disappointing. A small sample had received a single injection in 4 randomized separate regions on the scalp, and hair densities and hair diameter were measured 12 months after the initial injection. At various months, the hair density and hair diameter were measured using image analysis system software. Total hair density and cumulative hair density at injection sites significantly improved temporarily at 6 to 9 months post-injection with no adverse side effects. But data did indicate a slight decline in total hair count from 9 to 12 months. And to top that off, the best growth was a mere 5 hairs per centimeter squared at 9 months, which is not really significant at this point. You know, although repeat injections can definitely have the potential to show more promising results. And this is what Shiseido is currently doing. And the surprising thing about this study was that the lowest dosage of dermal sheath cup injections had the highest significant increase in total hair density and cumulative hair diameter compared to placebo. Higher doses of the injection did not correlate with more hair growth. And we also kind of tend to see this even with minoxidil and finasteride. There is this optimal dose that works the best, and simply taking more doesn't always correlate with more hair growth. As far as our speculation on why the lower dosage worked better, it could have been that a higher dosage could have caused more tissue damage, or that it could have created a poor environment caused by injection of higher number of dermal sheath cup cells. A study in mice did show that the number of viable cells remaining in the skin after injection was immediately reduced by a certain amount when they had higher cell numbers that were injected, which indicates potentially that there may be an upper limit in the number of viable cells that can be retained in the scalp. Now, another explanation for efficacy in lower doses is that debris of dead cells may cause inflammatory reactions such as immune cell migration, and it can also cause a poor environment for remaining viable dermal sheath cup cells. The study also showed that this treatment was actually more successful in older subjects and those who had moderate to severe type of hair loss. The speculation behind this was that older patients who received these injections on their scalp may actually have higher numbers of resting inactive hair follicles, so that the injected thermosheet cup cells showed more prominent improvement in the induction of hair growth. So that's kind of like the background with Replicel so far. Now, as far as the update, we know that they did enter a sponsorship or partnership with Shiseido back in 2013, where Replicel licensed Shiseido the rights to commercialize Rch-01 into Japan and other Asian countries. I feel like this was a smart move because they are well aware that Japan's new legislation has the expedited pathway program for stem cell technologies to get it out of the market a lot sooner. I'm not 100% sure what the exact terms of the agreement were, but with that partnership, Replicel basically had to agree to complete their own phase 2 clinical trials of Rch-01 and also to share that data with Shiseido for further development and research. But what actually had happened was that Replicel did not have enough funds for the clinical trials of, phase 2 clinical trials to commence. And this obviously caused tension and conflict with Shiseido since Replicel basically didn't put up with their part of the agreement. So Shiseido basically didn't share any of their studies and considered the agreement to be void. And this then obviously led to Replicel filing for an international arbitration a couple months back in October of 2021 to resolve the license agreement dispute with Shiseido. They either wanted full compliance with the agreement or to return the license and all collaboration data and innovations related to their Rch-01 treatment. In the meantime, Shiseido is still currently completing their phase 2 clinical trials involving repeat injections of the cell therapy. So definitely, there's a lot of drama going on, and at this point, I'm not even sure how everything is even going to move forward. But a few days ago, we did receive an update that Replicel had unfortunately terminated their license with Shiseido, which is pretty serious in my opinion. So, from the sound of it, they weren't able to come up with a resolution, and Replicel is doing everything in its power to prevent Shiseido from commercializing Rch-01 in Japan and throughout Asia. It's very unfortunate because Shiseido is, like I said, still undergoing clinical trials on repeat injections to see if they can bring about better efficacy, since the first clinical trial was based on a single injection. And if the studies did show greater efficacy from the repeat injections, let's say, something that was administered once every 2 to 3 months with the potential of, better hair density, hair thickness, this may be a treatment we can utilize to maximize our potential in regrowing hair, and also as far as maintenance is concerned. We already know that this is obviously not going to be a cure to hair loss, but if this is something that can be used to help increase density, hair diameter, hair thickness, and overall, improve the quality of hair, this is just one additional treatment that we can add to our arsenal. Something that also works in a different mechanism of action, all without having adverse side effects, is a big win. This will very likely also require routine injections on the scalp, since the initial trial saw a decline after 9 months of treatment. And I feel like this will also have to be administered in a medical setting. But I think that this holds a lot of potential because, so far for the past 3 decades or so, we unfortunately only have 2 FDA-approved hair loss medications for treating androgenetic alopecia, Minoxidil and finasteride. If we can add in something else that works in a different mechanism of action to add in more hair through the injection of the thermosheet cup stem cells, this would be a huge win in my opinion for the hair loss community. People who cannot use the conventional hair loss medication for whatever reason, due to side effects, would now have another option that they can look into and to add into their regimen. So I think there is really a big potential here, but the big issue is that Shiseido and Replicel really need to come up with a resolution to commercialize Rch-01 once and for all. I do not know what is going to happen between the two, especially after they've come, just so far over the past few years. But what I do know is that they will eventually have to come up with an agreement so that Rch-01 can eventually be marketed if the treatment is successful. If Shiseido can win the arbitration, there is a good chance that they'll maintain their licensing rights and proceed with the commercialization of Rch-01 in Japan and Asia. If Replicel can prove that they weren't given a specific date to complete the phase 2 clinical trials as promised, and that the contract they had with Shiseido wasn't breached, They're likely to get their licensing rights back along with all collaboration data regarding Rch-01 from Shiseido. Now, honestly, I would feel a bit apprehended going against such a behemoth such as Shiseido, which is just such a big company, but that's just me. And now previously, we also were told that this could commercialize sometime next year in 2022, but with this whole arbitration going on, it's difficult to say, and most likely it's not going to happen next year. But like I said, both sides have a lot at stake. They have invested a lot of time, a lot of money into Rch-01. Regardless of the outcome between the two companies, this research will become readily available if it is successful for commercialization after this hurdle is finally going to be overcome. Shiseido knows whether or not the treatment is worth pursuing, meaning that if they do continue to fight for this may be a good indication that, subsequent re-injections have been successful throughout their clinical trial. And until then, we just have to wait and see what happens. We should be able to find out what is exactly going to happen between the two in the next few months, because Replicel has been coming across pretty hard at Shiseido. But I will keep you guys updated once more information is obtained. But that wraps up the update for Shiseido and Replicel. Too bad that it wasn't something optimistic, but I guess some news is better than no news. There's a lot of companies who have not provided a single update, aka Dr. Suji. Not sure what is up with his team. Just dead silence. And the same thing goes for a bunch of these other companies. But once I get an update on these hair loss treatments that are currently in the pipelines, I'll do another video update for you guys. It's sometimes hard to keep track with all of these things that are happening. So if you guys happen to hear about an update, please do reach out to me or leave me some comments so that I can check up on it and give you guys an update. Also, if you have not watched my previous video on the free turkey hair transplant giveaway at Cosmetica, make sure to watch that and submit your submissions by the end of December, because the drawing is going to be finalized on the 31st of December, and hopefully in the next coming weeks, we are going to be able to draw and give out the results of the one lucky winner for the free hair transplant. But thanks for watching, guys. If you guys have any questions, make sure to leave me some comments below, reach out via email, and I'll talk to you guys in my next video. Take care.